The range of side effects noted with immunotherapies continues to increase. What are some of the side effects that we are becoming more aware of? So with immunotherapy, we are seeing more and more different side effects as we use these drugs in different settings. When we first started using them, we became really familiar with some of the most common immune-related adverse events, including things like dermatitis, pruritus, hepatitis, colitis, and pneumonitis, and thyroiditis. However, I was listening to a colleague talk about this recently, and they commented that as healthcare providers in immunotherapy, we now need to be prepared for the possibility of panitis. And I thought that was really well put because it's true. You know, itis just means inflammation, and so we can see inflammation in any area of the body. And so while we want to know what we would classically call our horses, also don't forget about the zebras. There was a really interesting case report recently of a patient who has metastatic adenocarcinoma of the lung and was getting treated with an anti-PD-1 antibody. This patient was responding throughout the sites of disease in the body, but was having what looked like progression in the brain. So this patient underwent stereotactic radiation to the brain lesions, but unfortunately they continued to progress. So this patient was taken to the OR for resection, and that pathologic specimen actually showed no evidence of disease. This was a case in which the patient had cerebral vasculitis that was mimicking intracranial metastatic disease. And so on serum, this patient was positive for ANA and antivascular endothelial antibodies, and that confirmed the diagnosis. So certainly that is not something that would have been at the top of anybody's differential diagnoses, but we need to do really good workup for all of our patients on immunotherapy who experience anything new.